Welcome back. Now, Moudou is on assignment. In health news, observers say the response to the Ebola outbreak in West Africa has highlighted both strengths and weaknesses of the global health community's ability to handle such a health crisis. Funding has proven to be a critical aspect of this issue. A new report by Global Health Technologies Coalition says the United States needs to do more, given its key role on global health.
The Global Health Technologies Coalition is an advocacy organization based here in Washington that focuses on advocating for new tools and technologies in the global health space to fight infectious diseases. We work mostly in U.S. policy, but also do some work at the global advocacy level.
GHTC just released a report. In a nutshell, it talks about the fact that since 2009, the U.S. government investment in global health for research and development has stagnated or decreased. When we know the important role that the U.S. play in global health, isn't that a reason for concern?
It is a reason for concern. The U.S. government is the largest investor of global health research and development. And so seeing that stagnant or even decrease is very concerning to us at GHTC. And we've been working with policymakers here in Washington advocating for that funding to be continued and to be sustainable, because research and development is a long-term investment. And so we really need that money to be there and for the U.S. to continue to make those investments.
So to what do we attribute this stagnation or decrease of fund?
Well, we've seen some real challenges in terms of budget negotiations with Congress over the past couple years. And, starting in 2009, budgets were really tight. And then we saw sequestration happen, which is a big word essentially that means across-the-board cuts to government agencies. And so policymakers were fighting amongst themselves around larger budget battles. And those budget battles really negatively impacted funding for infectious disease research and development across U.S. agencies.
Which then has a repercussion on global health in developing countries and around the world.
Of course, it does. A very serious consequence. We saw recently with the Ebola crisis in West Africa, we weren't prepared. We didn't have the tools and the technologies that we needed to address that challenge. And we don't know what the next global health challenge is going to be. So having those tools developed ahead of time and having the research and development capacity invested, that's what we need to ensure happens so that we're prepared for the next global health crisis, whatever that might be.
So why should global health that is of concern to other people be of concern to someone in the United States? I know we talked about how the Ebola crisis was an example of how we are interconnected, but why should someone care?
Great question, and we get that a lot, I think, on Capitol Hill as well. And the global health is really America's health is a good argument that we can talk about when people ask that kind of question. The other thing that's really important to note is that 64 cents of every dollar that the U.S. invests in global health research and development actually comes back to benefit U.S. researchers and work done here at home. And so that's a real stimulant to our economy. That's another thing that resonates with policymakers if it's about money. And then, of course, the obvious answer is that it's the right thing to do. And it protects and saves the lives of people living around the world. And that's also a really strong message when you're talking to policymakers. They do care about doing the right thing.
When we have a report such as the one that you just published, your organization just published, then what is the next step? Is it advocacy? Is it fundraising? What is it? It's
advocacy at all levels. We need to be interacting with our policymakers in Washington and educating them about the importance of this work. It is an upfront investment, and it is important for them to understand what that means down the road, because I think policymakers think in short-term annual funding cycles. A lot of them aren't scientists, and they need to understand from people like us, from advocates, why the scientific process is so important, why it might take a long time to develop a new drug or a new vaccine, and why those investments have to be sustained and continued year after year.
What is the way forward? What do you see as the way forward?
I think what we need to see is a strong commitment from the United States government, from agencies and from Congress to continue to make this a priority. We have investments happening across U.S. agencies. People automatically think about the National Institutes of Health as the leader in research and development, but other agencies, USAID, the Department of Defense, the CDC, the FDA, even all play a crucial role in the work that's done in infectious disease research and development. And I think seeing that sustained, that's really the way forward. We should be the leader. We should continue to be the leader in global health R&D. And I think, the advocacy work that GHTC and so many other organizations are doing is really helping to build that path forward.